Hi, Dr. Goldberg here, updating our infectious disease series. Today we're going to talk about Zika virus, which has been getting a lot of media over the last several months. Zika virus is in the flavivirus family, along with dengue fever, yellow fever, Japanese encephalitis, and West Nile virus. All these viruses are spread primarily through a vector, the mosquito, and Zika virus has been around really since the 1950s when it was discovered in the Zika forest of Uganda. It's been getting a lot of increasing activity and causing human disease since about 2007, but especially in the last several months, we've been seeing more and more of it in people that are living in the tropical regions of South America, Central America, but it can be found in other areas as well, such as the Pacific Ocean region. This is a virus that causes what we call Zika fever, which usually only causes mild symptoms, but it's been causing havoc in pregnant women if they get infected because of its effect on intrauterine growth restrictions, as well as what it can do to the fetus in terms of the brain, causing brain development problems and even microencephalopathy, as well as miscarriage. So over the years, the virus has been primarily an infection in monkeys, but again, since 2007, we've seen more problem in human beings. It's spread by the Aedes aegypti mosquito, and what's kind of scary is this mosquito has been found to carry Zika virus, and even Washington, D.C., it's been found that at least over the last several winters, there's genetic evidence that shows survival of this mosquito which shows adaptation for persistence in northern climates. The other scary thing is that the virus is likely able to be sexually transmitted, so there's a concern with that. There have been no confirmed cases of Zika virus transmitted through blood transfusions. And when it causes clinical disease, it's primarily going to be fever, chills, joint pains, headaches, conjunctivitis, and rash. Treatment is really just Tylenol, keep the temp down. There's no vaccine for it. There's no prevention. There's no way to treat it otherwise. And of course, we're looking for a vaccine now in the U.S. So yes, the virus has been around since the early 1950s, but since 2007, we're seeing more and more disease. Be cautious as you travel to these areas. Minimize your mosquito exposure or your mosquito bites. And certainly if you're pregnant, I'd be very cautious to even go to these areas where Zika virus is found. And if you're having sex with anybody that could potentially transmit Zika virus to you while you're pregnant, that's a special concern. So I just wanted to give you an update on 10 important facts about Zika virus. Dr. Goldberg signing off. Thank you.